Hello there, how are you doing? I hope that you are doing well. Now, if you've been watching previous videos, you may notice a little bit of a change. My surroundings are somewhat different because I am back in the office. That's right, in terms of having the lockdown of everyone stuck at home, it is no longer a lockdown situation. Here in Hong Kong, we still have some restrictions, but they're slowly easing off, and they may even ease off even further as the week goes on. We will see. But it means I'm in the office and things are almost back to normal. You can probably hear the noises around me of general office hum and air conditioning. And I suppose the biggest loss, particularly if you did like the previous videos, is that my records aren't behind me anymore. I don't have quite as good a view. But I'll tell you what I will do. I will take some shots of what I can see out the windows. I couldn't really shoot with the window behind me because you just get some terrible reflections, but I'll show you what the view is like. So at least you can see Hong Kong on what is, looking around, pretty nice sunny day, so it's all good. Anyway, I know the rest of the world is still feeling the pinch in terms of lockdown to varying degrees, and there's lots of stuff been going on. And this week, following on a lot from my data protection videos, I want to talk a bit about how data protection will be affected after the main thrust of this COVID-19 crisis has gone, as things calm down. And this comes down to something that happened, I guess, as it was kicking off in Wuhan, when there were the first few cases and Wuhan was going into lockdown. I was asked by a journalist what I thought about facial recognition technology and tracing people and monitoring all of their activity. And my view, if you've watched my videos before, my view is that facial recognition, if it's not used correctly, if it's basically completely unregulated, then it can go too far. There's a real privacy risk there. And I was asked the question, well, if the facial recognition, if monitoring what people are doing is saving lives, is that not a decent sacrifice to make? And it was a pretty tricky question for me to answer, because if people are dying, then maybe you do want to restrict their movements somewhat. Certainly that's what's been happening in most of the lockdown situations. Certainly you do want to be monitoring where groups may be forming, where there could be clusters of viral infections. Again, it's a good thing. So I was trying to explain that it's a bit of a balancing act. But the problem with a balancing act is in which sense does the balance actually work? And people will have a different centre of gravity depending on where they're from, depending on the government in charge of the rules, depending on the companies behind the rules. So maybe you need to think a bit more carefully about how you don't go too far. Now, this has been brought sharply into the news in the last couple of weeks because we have seen the emergence, and two of the big tech giants are behind probably the most prominent one, of contact tracing apps. Now, it's Apple and Google who are working together to develop this. Now, contact tracing, before I talk about what an app is, contact tracing is absolutely nothing new. Contact tracing, when you have a situation where people may have suffered from a viral contagious infection, you want to make a note and be aware of everyone that they have met, spoken to, been in close contact with. The reason for this is that you can try and identify clusters of infection, so you can try and control where the virus is going. Think of it as trying to put a big ring fence around places that stopping that area getting bigger. If you've played the board game Pandemic, I know I've mentioned it before, if you have played it, it's probably sold out by now because I'm sure everyone's playing it, then you'll see how viruses spread. You get a group and it spreads to another location. Using contact tracing, you try and stop that happening. Now, here in Hong Kong, a lot of the restaurants, gyms, various organisations are starting to open where you can go for some sort of social occasion. But what they are doing, which is interesting, is that when you arrive, you'll be asked to give your name, your contact phone number, and then self-certify that you haven't been into contact with anyone who may be infected or been to an overseas location in the last 14 days. All standard stuff. But what does happen is then if there is an infection at that location, that information will be passed on to the Centre for Health Protection here in Hong Kong, who will then phone you up. So suppose, for example, you're in an office building or you're in a restaurant and they find they've had a case of a confirmed COVID-19 person, you may find the Centre for Health Protection says, right, we need to come and go, have some tests and spend some time in quarantine. Now, for me, and this is a completely selfish view and I do not advance it, I am absolutely terrified of that. That's been more of a deterrent for me going to any bars, restaurants or anything else, because I've heard some of the quarantine places that you have to go to, they don't have Wi-Fi. Can you imagine a technology lawyer without any access to technology? There was also a video online of a guy who'd prepared for it to the nth degree and packed a suitcase with a PS4 ready to go into his quarantine for 14 days, all the latest games. and there was no TV. So he was kind of just sort of staring at a big piece of plastic, and he probably couldn't even read the manuals to the games because they don't really have manuals in them anymore. But anyway, a contact tracing app is essentially doing that whole material, filling in the forms and trying to figure out if someone gets ill, have you been in close contact with them, but doing it all with technology. And Google and Apple's system essentially uses Bluetooth on your phone, so you have to log if you've had the illness. You'll keep Bluetooth switched on, and it will monitor who you've been in close contact with. So it will be essentially sending a notification over Bluetooth, I've been near this unique identifier, the identifier being the unique model and whatever distinguishing characteristics they have of your actual phone, and then it will alert you if you have been in contact with someone who's had the virus, and then recommends that you essentially go and get tested and get some medical care. And I have to admit, I think it's a pretty good idea. I like the idea, the fact that we can use technology, because we have a virus here where people don't know if they have been infected. Remember that? Often you have asymptomatic carriers who don't know they've got the illness and they could be passing it on. So technology leading the way, and that's great, and I am massively enthusiastic about it. However, the data privacy lawyer in me starts to wonder, what if, I mean at the moment it's completely, the Apple-Google solution, it depends on how it's adapted by nations, individuals, and it's completely voluntary. You don't have to sign up, you don't have to download the app, you don't have to do anything that will force you to monitor whether you've been in contact with someone. And that's fine. They've also recently said that they will not allow anyone to use location tracking if they're using a contact tracing app. So it won't take any more data than whether or not you're ill, so you can go and see a medical practitioner or professional, whatever you want to do. But it's very easy to imagine that this won't be the case in all jurisdictions. Now, when I was talking about data protection, different views in different jurisdictions, I've focused on the EU model. It's very much protecting personal data, which would include medical data, biometric data, all of that, versus, for example, the model in China, which is very much about protecting the state. And if you look at what was happening in Wuhan, they now essentially have a phone enabled via essentially via Alipay or WeChat passport that assesses whether they're in a risk category. It's a traffic light system, green, amber, red, and where they can go. So if they want to go into certain malls, if they want to go into restaurants, they have to show their phone, will blink up and say, I'm green, I'm absolutely fine. If it's orange, it's like, probably not fine, don't let them in. And if it's red, you need to go and get checked out. So different jurisdictions will do it differently. Now in Wuhan, for obvious reasons, it's not something you can opt into, you have to do it. And I wonder if that will be a model in other states. Now first, let me have a quick look at the technology and how it would actually work. So I'm using the Apple-Google method as an example. So here is your phone, you download and you make sure you've got the app running. The app runs in the background at all time. It probably uses low power Bluetooth to make sure it's communicating and keeps the Bluetooth on at all times too, because most phones would actually turn Bluetooth communications off after a set period of time. Now you go about your business. Suppose you go to the mall, you walk around, you don't come into close contact with anyone who's got the virus, therefore your phone doesn't do anything, but your phone will be sending a notification over Bluetooth that you have been in contact with that person. So every phone, these are all of the phones that you would essentially have within that mall, every phone you've come close to will then know that you were close to them, and that's all fine. So then, suppose you go off to the cinema, same thing happens. Suppose you go to a restaurant, the same thing happens. Then, to your horror, you develop a bit of a cough and you think you're not well, and you get essentially go to the doctors to get tested and are notified that you have COVID-19. What you would do on the app, you would open it up, say, I have symptoms, I am not well, or I have been diagnosed with the virus, send it to the app. The app will then notify everyone that you've been in contact with, completely anonymously, it won't take your name or any details, that essentially they have been in close contact with someone who has or may have the virus, recommending they get tested. And that's a pretty clever model. I mean, think about it. It gives you a bit of peace of mind. It probably doesn't give you peace of mind when you get the notification you've been near someone, but at least you don't have that lingering doubt of, oh, what if that person who I was in the lift with earlier this morning on the way to work, who was coughing a little bit into their mask, what if they had the virus and I'm going to catch it? It avoids that issue completely. And that's pretty clever. But the thing is, it is voluntary, and that information doesn't get sent anywhere unless you essentially send it to someone yourself. It's not at the moment used by any medical organisation, it's not used by any government. So let's think what happens if that isn't the case. So as I said, use of the app is entirely voluntary. If you go on, I'm obviously using an iPhone, if you go on the Apple Store at the moment, there are all manner of contact tracing apps currently available. I'm not going to download any of them because I haven't checked how valid any of them are. I haven't checked what information they're taking, but they, the principle behind it works. I certainly haven't checked what sort of information they may be taking from me and passing on to others. But suppose the Apple-Google method is completely anonymous, but suppose that it wasn't. Suppose that you are required to download an app, be it by your government, your health service, who knows, where you put in all of your details. So you put in things such as your personal address, work address, postcode, and there's valid reasons to want this, because then if there's an alert that you may be infected, you can go to that address and make sure that there are no other cases, or at least ensure some sort of protection is put in place in those locations. But imagine then also it collects the details of people you've actually been with. So you've got personal data of your families and passes that on to health services. I mean, where do you stand on that? I'm curious what you think, because go back to my facial recognition example at the beginning of the video. I'd like to think that that's okay, but a lot of it's going to come down to the level of trust. And how much do you trust an organisation with your data? So if you have a contact tracing app and it's collecting data incrementally, so it starts off with just your unique phone identifier, but then it collects data on who you fraternise with, where you live, and obviously then your health data as well if heaven forbid you fall sick. If it's slowly collecting that data, how much do you trust it? And I think distrust of organisations collecting personal data, and certainly this health, all of the information here is personal data, is at an all-time high. And people are rightly concerned. This is why, for example, the Google Apple solution, as it stands, doesn't collect any personal data, but many organisations would want it to. Many health services would want it to, but many people who are against essentially collection of data or trying to protect privacy would be worried. Now, let's look at other jurisdictions. I'm focusing this very much on a GDPR focus, and that actually you would have to essentially get someone's consent. It would have to be very explicit consent if you're collecting any data on them that is covered by the GDPR. And then this is the data that will be covered would be health and biometric data. It's medical data, so they couldn't fudge it. It would be very, very difficult to say there's a legitimate purpose, and that I don't think you could actually override the consent in this requirement. But think of nations, and there are plenty of them. Think of organisations, and there are some of those as well, but let's do nations first, where you don't have a choice. You're required to download an app, where an app won't let you use it because it's something that is required for your day-to-day life. For example, suppose if you've ever tried to pay for anything in China with Alipay or WeChat Pay, imagine Alipay and WeChat Pay required you to sign up to a contact tracing app that allows it to send its data to third parties, otherwise you can't use the service. You'd have no choice. I mean, I suppose the Chinese government could just say everyone has to have this app anyway because we're so worried about the spread of the virus, which is, again, would be an issue. Then it becomes a problem. And so we find that we may be in a position where, as the coronavirus crisis continues and slowly, hopefully, starts to ease off, we enter into a new privacy landscape. What sort of information are we prepared to sacrifice for the sake of public good? How far does the public good go? And it becomes a very, very philosophical question. I'll be honest with you, I don't have the answer. My view is you don't want people to get sick. If you're saving lives, then surely it's a good use of your personal data. But then what if that data is stolen? What if there's a hacking attempt? What if that data is then kept and used for something else 10, 20 years down the line? Certainly GDPR hopefully would prevent that. You would make sure the data can be deleted, you can access it, and so on and so forth. But that isn't necessarily the case everywhere. You can't be reliant on that. But then let's go to organizations. Suppose you're an employer, or suppose you're running a factory and you want all of your workers to download and install the same app. How would that work? What if you say if you don't install it, then it may be disciplinary procedure, or you won't be allowed to come into work or work for any number of days, simply because there can be no confidence that you might not be sick? Then it becomes a collection of personal data where you're almost certainly going to give your consent. Whether it's actually valid consent, it may be debatable, but it is still an issue. Now, I think this is going to be a problem going forward, because as organisations go back to work, they're going to want to make sure that it's a safe workplace for their employees. most organisations are not going to want to face the horror that they open up and suddenly they're closed down for any number of time because of virus scares, or they lose customers. Suppose you are we had an issue here in Hong Kong. We have a few branches of Marks and Spencer's, and some employees were tested positive for the virus, and they had to close the branches where they worked for a couple of weeks, which, you know, a good thing to do, and well done M&S, and it made all of the customers feel safe. But it can't have helped their bottom line in terms of financial performance. That must have been a real issue. Also, it was over Easter, and I had friends who were very upset that they couldn't find hot cross buttons, but that's by the by. But think about that. What is the landscape going to look like for privacy after this virus issue has hit? And there's a couple of alternatives, and let's have a quick look at those now. So the first alternative is pretty much things go back to normal. We have contact tracing apps on our phones for a while, the coronavirus crisis subsides, and then essentially after 6 months, with a bit of luck, everything is back to normal. We're all going to work, nobody's wearing masks, and this is all just a memory. It's like talking about something that was a terrible nightmare that happened at the beginning of 2020 or the end of 2019, depending where you want to start this. But I think that's very unlikely. The other alternative is that we end up in a position where organisations, not necessarily companies, organisations, be they governments, health services, or in some cases companies, but I would doubt they would have the power to do this, start making the rules about what data you are required to give away. And that data is almost certainly going to be health data. I don't think that the anonymous approach to contact tracing apps is necessarily going to work, because people will want to know more than just you've been in touch with someone, make sure they go to the doctor. Certainly we found, even here in Hong Kong, when people were diagnosed or thought they may have been in contact with someone who had been diagnosed with COVID-19, a lot of people just panicked and didn't want to tell anyone and went into hiding for fear of what the outcome may be, what sort of hospital they will end up in. Others immediately went to hospital even though there was nothing wrong with them, but there we go. People have different approach to these things. But I think this mandatory supplying of data will become a norm. And the question then I want to put really to anyone who's really concerned about this is, how far is too far? So, an app that records data on everywhere that you have been and then can monitor if you've been in the same place as someone who might be ill, and then reports that back to a central server that compiles that and then can use that data for data modeling. Maybe they can sell that data to people to try and figure out, a new approach to controlling other pandemics, other viruses. But it's a mandatory app. That is one possibility. One opportunity is probably right for some companies. I've always seen this as a potential money spinner. But is that acceptable? Because I think that is very likely. If you think about it, an opt-in model, if you are a government trying to protect your population, doesn't necessarily work. But I don't see any alternative. As much as I am enthused with the contact tracing app that Google and Apple are putting together with their technology, I don't think that is the end of it. And I do think we're going to face, I think in the next few years, a whole new battleground in terms of privacy law. And I just don't really know where I stand on that yet. I don't want data to be used for nefarious purposes, but when you're collecting data because essentially you think that you're trying to save lives, when does that become a nefarious purpose? I mean, we can totally think of some awful company then takes that data, uses it, sells it, maybe publishes it online, or loses it, leaves it on a train, or does something terrible. But there may be other ways that it could be used to control people, saying there's been someone you've been in contact with in the last 14 days, therefore you're trapped in your house, you can't go outside. It is a bit of a concern. There was certainly a concern here in Hong Kong, for example. We have social distancing rules where you can't have groups of more than 4 people together on a street. And there was a fear that that was going to be used to try and quell some of the protests here in Hong Kong. We haven't actually seen that in the scale that people were predicting it. But again, people will always assume that anything that's designed to help people, which the social distancing rules are, could also be used for bad. So there we go. That's it. I don't have any answers this week. I feel like I'm asking more questions than answers, but I'd be very interested to know what you think. And I might, I'd be tempted to do a follow-up video, really to talk about some of the things and different views. It might be quite good now that things are reopening to talk to some data privacy professionals and see what their view is. How far is too far? Should we allow data? Is this a free-form world where the data can be used however we want it to be? Certainly not the case anymore. But should we be in a position where we withhold data and we don't save lives? You see the dilemma. I need to think of a good name for the dilemma, but it's certainly a dilemma. Anyway, That's it from me for this week. Hope that you enjoyed the video. Hope you enjoyed the new background. Again, there's shots of the office that I will, well, the office window, put it that way, that I will add to the video, and you can have a look at some of those. But in the meantime, have a very good week. If you've got any questions, do let me know either on LinkedIn or on YouTube. Please do subscribe to my videos, and I'll be back very, very soon. Take care.